So, good afternoon. We have Christina Burns here. Christina, thank you so much for joining me today. I love your office, by the way. It's
Oh,
beautiful.
thank you. Thank you.
So, tell me, how long have you been in practice?
22 years.
Wow. And how long in private practice?
Um, Almost 18 years.
Wow, that's a long time. Okay. And you're currently in Germantown, is that right?
That's right.
Wonderful. So, what kind of, what would you say your specialty areas are?
Uh, I'd say I have a general practice, but I primarily treat eating disorder and trauma.
Okay, excellent.
I do like to work with other issues, and I see occasionally some couples and things like that. But those are my primary focuses.
Okay, wonderful. And what insurance panels are you on?
I only take Cigna right now, but
Okay,
I'm happy to provide a super bill if anybody wants to have their insurance filed
okay,
themselves. They can do that, and I'll give them a super bill for that.
right. And private pay?
Yeah. Hmm.
Okay. Um, and let me think. So, as far as the pandemic goes, have you seen any particular increase in anything like depression, anxiety? I'm hearing that a lot. So, I'm curious as to what your take is on that.
I would say that most people are seeing that whatever issues they already had, they're struggling with just as an increased stressor. So, like if whatever you already were struggling with just seems that much harder to deal with. Like if you had a tendency to feel depressed, now you're isolated, and so your depression seems more overwhelming. If your tendency was to feel anxious, you feel more anxious. So whatever your issues were, they just feel more overwhelming. I have gotten a lot of calls from people trying to find an appointment for anxiety, so I do think that's probably uh, one of the biggest issues that people are struggling with right now. It's an anxiety provoking situation that we're all in.
Yes, it very much is. Um,
But I do think, this is one of the unusual situations for clinicians out there. A lot of times we have people come in for sessions and we can relate to them in some way. Like we all hear stories in our clients that we can empathize with them because something about their story feels similar to something we've experienced in some way. But we don't usually have the experience of actually going through the same thing at the same time that our clients are going through it. So, it's difficult for everyone right now. Not only difficult for our clients dealing with whatever they're struggling with, but also going through a pandemic. But we're going through the exact same thing.
Absolutely.
So,
It's a very
it's
unique situation.
yes, it's very unique.
Well, and that's the other thing that I've been talking with other clinicians about is the importance, of course, of taking care of ourselves and
Right,
making sure that our needs are being met so that we can truly provide good service to others.
right.
I know you do that well. So,
Yeah, sometimes better than others.
well, we're all human, it's never perfect.
Right, right.
And so, what are you seeing as a result of the pandemic when it comes to the different modes of therapy, be that in person or telehealth? Are you seeing a difference between the two? And if so, what does that look like to you?
Um, I mean, I think we probably all would agree. Maybe not, maybe not. That's probably a big assumption to make, but certainly I feel that in person is superior to online. Um, but I think online is certainly better than not being able to provide therapy. I think that some issues are probably harder than others to treat online. I have some clients who are experiencing a lot of depression and anxiety whose circumstances are already very isolating. And for those clients, having to be quarantined is particularly stressful when they already really struggle with feeling isolated and lonely, to then be even more isolated as a result of the virus. And so trying to figure out a way to work around those issues while only being able to work with them online is really a struggle. And then also with eating disordered clients, who need to have their weight taken, and just to see physically if they're medically in jeopardy, can be really a struggle. So I know that there are some disorders that we are addressing that can be more difficult to treat online than others.
Yeah, that makes perfect sense.
Right.
What would you say to someone that's currently looking for a therapist? What types of things would they need to look for, just in general?
I mean, I think the relationship is probably the very most important thing. Just knowing that even when you just call to make an appointment, when you are just having that very first interaction, do you feel comfortable having a conversation with the person from the very beginning? I mean, do you feel like they're kind and they're compassionate and you have a good interaction with them from the very beginning? I think everyone is having the same experience of getting a lot of calls right now.
Sure.
Just in that very first interaction, do you feel like you can relate to this person, and does it feel like a good fit? And like if you go and you have the first appointment and it doesn't feel quite right, then just try someone else.
There you go.
I was laughing with someone the other day. A patient was like, "It's not a marriage," and somebody's going to come and have an appointment with me, and they think like, "Yeah, that Christina, she's really weird. I don't like her at all." That's okay. It's not a marriage. They can.
Yeah.
It's fine if I'm not the right person for them. I won't be the right person for a lot of people. And then someone else is going to come in and they're going to think, I really like her. I can talk to her, and that feels like a good fit. And that's the way it should be. So
absolutely. I totally agree. Well, thank you so much, Christina. Is there anything else you'd like to share before we wrap up?
Just, we're all in this together. I know it's really hard for people out there looking for therapy, and also for the therapists out there trying to provide it. So, my heart is with you.
Absolutely. Thank you, Christina. Really appreciate this.
Bye.